is very helpful. However, I find that it's more helpful if they start feeling it in their bodies. They're able to then relate from a different place. And I think I mentioned I practice from this biopsychosocial spiritual model. So for someone to tell me about their biology and to tell me about their genetics, I still want them to feel that in their bodies. But we will look into like lab work when someone first comes in. That'll be the first thing that we do. Make sure that we're ruling out any kind of organic causes that may be causing the mental health disruptions. If that means that I need to collaborate with a functional medicine doctor to do any kind of hormone therapy or hormone labs, or collaborating with other providers, that is kind of the name of the game. I love collaborating with other people. This is really a team effort. And so I just want to make sure that I'm ruling out all organic causes before we go into treating the mental health symptoms. In terms of other biological factors, I always ask about food. We talk about like glucose regulation, making sure that they're eating enough protein. You know, a lot of people are intermittent fasting, and that might be appropriate for some people. However, I'm noticing that people that intermittent fast, their anxiety will spike before they eat a meal. And so we want to make sure that we're regulating for any kind of glucose spikes that cause the anxiety as well. And so just providing education about nutrition is important. Talk about water intake, caffeine. A lot of people don't know that caffeine intake will increase their anxiety or make their depression worse later in the day. So we talk about that. And then sleep. Sleep is a huge one. So if someone needs a sleep study, that's something that I'll recommend. We'll talk about also circadian rhythm. So making sure that as much as you can, you're getting outside, you're seeing the sunrise, seeing the sunset, making sure you get that sunlight in your eyes to really help regulate that circadian rhythm, especially with those people who have insomnia or have trouble sleeping. So that's kind of like the biological part. I guess the other part of that is also looking at their history, looking at their own medical history. A lot of people come in with chronic pain, autoimmune diseases. So making sure that those things are being worked up and handled by a functional medicine doctor, whoever they would like to work with. And then also looking at family history, you know, making sure that we take into account if there is a history of, let's say, bipolar or schizophrenia, or even depression, anxiety, suicidal ideation or attempts in the family. That's going to put me on high alert to make sure that we're looking for those things in my clients as well. So that's the biological part. The psychological part is probably a lot of what you guys do, you know, looking at what kind of thought processes do they have? Do people live in denial? Are they codependent? Do they, you know, are they giving up their own control? So I want to work with that with my clients to make sure that I'm meeting them where they're at. Because even though I'm a holistic provider and people come to me probably knowing, oh, she's someone with all of these tools and holistic ideas, there's still a lot of resistance to it, even when people sign up for an appointment with me. So I want to meet them at their resistance. I'm not here to convince them otherwise, but making sure that I know where they are coming from is really important to me to work with them. And then the social aspect, looking at their community, their family systems, who their support networks are. I do a lot of behavioral changes with my clients. So medication and supplement management is one thing I do, but then behavioral changes as well. So if someone has always lived a certain type of lifestyle and their spouse or their loved ones are used to it, when they start changing, that's going to change your family system and your support network. People are probably going to feel uncomfortable or not know how to approach things. For instance, like if someone decides that they want to stop drinking, a lot of times social events start changing, right? On Friday and Saturday nights or on the weekends, and people in their families or friends might not react favorably to that. So we talk about how we can approach those changes in their social network. And then the spirituality part I touched on, just making sure that people have that connection to their higher self. So yeah, I work within that model. I do medication management when it's necessary. I'm not someone who's super pushy on medications. I think that they have their time and place, but I do think that if we can support our clients in making these behavioral changes and maybe using supplements to support their mood or their sleep, then we can actually go a lot further than just like slapping an SSRI on their regimen. I do think it's helpful. Like, you know, I'm not saying that I don't want to use medications, but I just really want to empower my patients to feel like they have control over their treatment plan and that they're not just going to take a medication and be cured, because that's not going to happen. I'll tell you guys a little bit of my background. I graduated medical school in 2019. I went to Michigan State Osteopathic Medical School, and then I went to do my psychiatry residency at Lutheran General in Park Ridge, and loved my residency. I was always going to do psychiatry, but I think what I started noticing is the treatment was really limited. It was a lot of just medication management and prescribing. And I actually started noticing myself burning out from treating clients that way. And people would get better for like 3 or 4 months. And then they would come back and they'd be like, oh, I'm not better again. I think it's my medication. I'm not doing well again. Can we change it? And it was just this cycling pattern that it just felt like I was feeling hopeless for them because I felt like I had nothing else to offer. And so I started, talking about behavioral changes, started talking about their sleep, their nutrition, all of these things. And that ultimately then led me to do a fellowship in integrative psychiatry through the University of Colorado. And through there, I learned more about nutrition, supplement management, about like your GI system and how much that can affect your mental health, hormone levels, all of these things. And it just really gave me this whole-centered, holistic approach for my clients. I'll tell you, I had a lot of pushback from my colleagues, like in residency and from my higher ups. And I think at some point, my intuition was just too loud for me to ignore it. And I was like, you know what, this is the way I'm going to practice. And I started bringing it in, even in residency. And my patients responded. Like everyone wanted this. Of course, there were people that didn't, and they just wanted traditional medications. But most people that I brought this up to were like, yeah, we want more. Like, tell us more information. And we'd rather try the supplement, or I want to try these behavioral changes. And so because I was seeing that excitement in my patients and their willingness to try something else, I just continued that training. And once I graduated, started my own business, and I see patients for the integrative psychiatry side of things. And people get better. I mean, there's just so much more improvement when you hand back a client's power rather than just prescribing them medications that they feel like is their only option. So it's something I'm really passionate about. I grew up in a family that practiced holistic medicine. My mom was always giving us herbalistic, treatments and, doing meditations. And my mom's also Reiki trained. So it wasn't something new to me, but it was new in the way that I practiced with my patients. And now I'm kind of sprinkling in some astrology because I'm kind of obsessed with it. And I think I've started to notice so many patterns in my clients. Like I'll have people come to me week to week, like the same thing happens in that week with like 5 different people, and the following week, like it's just the same type of energy. And so I'm starting to bring that into my work with my clients who are open to it, of course, and just talking about how what's within us is just mirrored outside of us and vice versa, and how we can approach that with compassion. I think using astrology actually helps people bring more compassion to themselves. They're not as hard on themselves if they know, oh, this is just the energy of this week. It's not my fault, or it's not someone else's fault. It kind of lets them step outside of themselves. And if they develop more compassion for themselves, they're going to develop more compassion for others. And that's going to be a really beautiful connection. So yeah, that's kind of how I practice. Some of the benefits of working with me, I don't take insurance, but part of that is because I see clients for a full hour. My first client appointment is an hour and a half, and that's just to get to know each other, understand what they need. I really value the patient-client or the patient-doctor relationship. I think that's actually where the improvement happens, is if you trust your doctor, if you feel comfortable expressing how you feel. And so that's why my appointments are that long. I mean, for other reasons as well, so that I can actually know what's going on with them. But I think it really helps to develop that relationship. And then also collaborations. I love collaborating with people. If you guys ever, send me someone, or I send you guys someone and we want to collaborate together, shoot me an email. I'm happy to give you guys a call. I'd rather work as a team. I do not have the capacity to do everybody's job. So if we could all, take ownership of our skills and then talk about it, put that together, it's going to benefit our client way more. Yeah, I don't know, maybe there's other things, but if you guys have any questions on how I practice, or I guess what kind of patients I see, I mostly see adults. I do see some adolescents as well. But the caveat is that family usually is holistically minded. So I'll see, people whose parents maybe are into integrative medicine and things like that. But mostly adults. I see a lot of depression and anxiety, people who really want to live a more fulfilled life. I do see some patients with bipolar, but I think it is, I think less so, just because the supplement management maybe doesn't work with their mental health symptoms as much. And then insomnia, OCD, a lot of trauma work. I do some psychosomatic work with my clients, not like a full therapy or anything like that, but kind of what we did at the beginning of the session, where I really want people to feel into their bodies. I think a lot of times they don't even know what an emotion feels like. They don't know what it's like to access anger or sadness or shame. And so we work on feeling that in our bodies so that they can actually relay how they're feeling. So then I know what kind of treatment plan to provide. And then I'll do breath work. I'll do meditation with people. I am Reiki trained. I don't practice that as much with my clients, but we work from that energetic perspective. And yeah, any questions for me?
Hi, Anna. I'm Sydney. Thank you for being here. I love all of this. This was amazing. I love that part about just your intuition was too loud to ignore. I think that's an amazing thing to hear. Seems you really carved your own path here. Something that really sparked my interest was the glucose monitoring that you kind of mentioned, and I was going to ask some questions about that. So I've actually been reading a lot on that recently, because I've seen a lot of work with it within eating disorders, particularly like binge eating disorder, and how key of a component that can be in working with clients. And I was wondering, when you incorporate looking at that with clients, are you using like continuous glucose monitors, or are you taking more of like an intuitive approach to try to be more in tune with that and like recognize that to be able to kind of like feel what's going on? Or what approach are you taking with glucose monitoring?
Yeah, we can do both, and that just depends on the client's wants, access, needs, all of those things. At the simplest form, especially let's talk about like the binge eating disorder. I think there are so many components of why a binge eating disorder comes up, but if we look at it just from the nutritional side, there's some nutritional aspect that's missing. So that might be someone that's restricting in some type of way, even if it's not, considered like, let's say, an anorexia nervosa disorder, but someone that maybe is trying to lose weight and not getting the proper nutrition in, or there's some kind of a lack. And so with those clients, I really suggest like 3 big meals through the day and eating carbs, proteins, and fats. I know there's so much different advice on nutrition, whether we want to vilify fat or vilify carbs or even vilify protein. But I really think like with someone who's binge eating, you need all 3 of those components to feel satiated. Like our brain needs to feel safe so that we don't binge eat. But then from like a glucose monitoring standpoint, what's really helpful is then we can track, okay, my blood sugar spiked. And how did I feel during that time? Did I feel anxious? Did I feel more restless? And then when it dipped, because most times if your blood sugar really spikes, it drops pretty low afterwards. Okay, did you feel depressed? Did you feel tired during that time? Did you start having ruminating negative thoughts, or did your OCD increase? So starting to kind of map that out for people, and then learning how to eat around that, learning how to balance their blood sugar levels, and then using an intuitive approach. So I don't think that you need a blood glucose monitor forever. I don't think it's actually helpful to have that, but maybe having it for a few months, learning these behavioral changes, and then starting to kind of tune into your body, like, oh, today I felt a little bit more anxious. Oh, that meal I ate didn't have enough fats. Okay, tomorrow I'm going to increase the fats. So looking at it that way.
Okay. Yeah, that makes sense. Thank you.
Mm-hmm.
And how, like, kind of a follow up on that, like, how receptive would you say clients are, or question on like how receptive they are, but also even just giving this information, are they surprised by it? Like, is this the first time they're kind of hearing this of, yes, blood sugar, glucose levels, and mood do connect? And it's not to say that if you have perfect balanced blood sugar that you're not going to have anxiety, depression, or mood dysregulation. However, it also can have some connection. So how do clients respond to hearing this information?
I think everyone is different, but I think when they're coming to see me, they're going to expect that we talk about food, nutrition, and holistic treatments. So I like to start off by talking about how food, caffeine, and sleep affect our mental health, and making sure that we get those things in order. Like, I think about like Maslow's hierarchy of needs and how the bottom level is the groundwork. We have to build the groundwork. So if your sleep, your appetite, your water, your caffeine use, your shelter, it's not there, you're not going to be able to rise up to that self-actualization and start becoming the person that you want to be. So we always talk about that groundwork first. Some people are more open to it than not. And again, that's where it comes in of, okay, I have to meet you where you are. And Jenna, you're absolutely right. Like, we can get all of that groundwork totally perfect and you can still have anxiety and depression. But if we don't work on that, I think it's harder to get some of that mood and anxiety under control. And then I have some people that are like, I'm not interested in that. I want to go this direction. That's fine. We go the other direction. And maybe a few months later, they come around because they notice that things aren't improving. So we stay patient and we see, where our clients guide us.
Yeah. Excellent. Thank you.
Any other questions? If not, I would love to get to know you guys. I've gotten to know Jenna. Oh, were you going to say something?
Oh, no, go ahead. I mean, I do have a question if you...
Go ahead. No, go ahead.
Go for it. The more questions, the better.
Okay. It seemed the spirituality kind of came up a couple of different times, and one of the ways in which you kind of described it was like something bigger than themselves. So is that kind of the framework that you work off of with like the definition of when you think of like spirituality? And then also, yeah, so the first part of that is kind of like, how do you define spirituality? And then how do you introduce that with clients? And if they're, so I wrote down that book, The Awakened Brain. That sounds very interesting. And then how do you introduce it with clients who are kind of like curious about it, maybe aren't going to take like a traditional approach with spirituality, with some sort of like organized religion or something, but wants to be open to something? Like, how would you go about kind of introducing that with clients who are curious?
Yeah. So for me, spirituality is a connection to self and something bigger than self. So it's both of those things. But I do ask everyone what their definition of spirituality is, because I do think it's different for everyone. On my intake form, I do ask, do you have any kind of connection to spirituality or religion? And so that already kind of gives me a little bit of an idea if that's a part of someone's practice. People who don't answer, I'm like, okay, it's not. But some people will say that they have some sort of practice, and we usually start there. I don't usually call it spirituality when I first start working with people, because I think that term can be really scary or just feel, I don't know, too big. I usually, like, one of the first things I do, most of my clients go home with homework to do gratitude. Like, every night, gratitude journaling, whether that's like one thing or 10 things. And that just depends on the person's capacity. I think gratitude is a great step into spirituality. I think it makes you realize that things are bigger than yourself, that there are wonderful things in the world. And then we start connecting to more and more things. So maybe we'll do a breath work in a session, or maybe we'll do a meditation, or I'll ask them to, visualize something that they want. And then I'll ask them how they feel. And if they're feeling connected and they're feeling like it's working for them, then I'll bring in the idea of spirituality and explain what it means and how it works and the research behind it, and see if they connect with it and dive deeper into it. Did I answer both of those questions? I'm not sure if I did.
Yeah, no, those
Okay.
are that's a lot of great information there. Thank you.
Mm-hmm.
Yeah, I love how you, because that's often something that I feel like I struggle with bringing up to clients. And we also ask on our intake if they have a spiritual practice. But to be able to start with like the little droplets of, okay, like let's talk about gratitude and then see how that feels. And then meditation, breath work, visualization. And then seeing like, as I'm sure you could probably even sense like their body or their like capacity just kind of opening up a bit,
Mm-hmm.
and then feeling out that word of spirituality and seeing if like, or even saying like, oh, like doing, like I did a meditation one time where a client and I just looked at, like, she had a plant in her room, I have them in mine, and we just kind of looked at them for a few minutes together, just like in silence, just noticing. And so even something like that, where it's like, oh, did something feel like a connection here that you haven't felt before when you look at that plant on your desk, right? And so even just kind of easing that language in, I think, is a good place when working with clients. Like I can envision that for myself.
Mm-hmm. Yeah, and I think when people are feeling hopeless or, just not seeing the light at the end of the tunnel, I try to have them connect to a time when things did work out for their benefit. And so if we can start sprinkling that spirituality or the gratitude, things like that, it's going to be a lot easier to access that down the line. And, just from my own experience, I went to medical school, and a year in, I was having horrible panic attacks, and I studied psychology in undergrad, and I did not know what was happening to me. Like, it's so different when you experience it yourself versus reading it in a book. And I actually took a year off of medical school to figure out what was going on with me and figure out, was medical school really the path that I wanted to take? And when I look back at that time, things worked out exactly as they should have. But in that moment, I remember how hopeless it felt and how much I was struggling to make a decision and not disappoint others and things like that. And so I just think about events in my life that brought me closer to trusting the universe or trusting that higher source or trusting God, whatever that is for a client. And I try to teach them to connect to that. Like, let's identify that one moment where you remember that things did work out. Okay, see, you didn't maybe trust at that time, but you could see that it worked out well. So now let's try to sit in that trust. Like, what does your intuition feel like? What does your body feel like in that trust? Helps people feel more connected and feel more hopeful.
Mm-hmm. Great. Thank you for that.
Mm-hmm. Yeah, I'd love to hear about all of you and maybe just a little bit about you guys and what kind of clients you like to see. I would love to continue to refer to you, but it would be easier if I had an idea of who you like to practice with and what your, just how you guys practice. If you do have more of a holistic approach, or if you do more CBT or DBT or whatever that is, because all of that is needed. Anyone can start.
I can go. I'm Natalie. I work with clients with primarily eating disorders, anxiety, and ADHD. For eating disorders, I would say I use a very holistic approach of just, I feel like eating disorder, it's a very much a whole body experience, as well as like whole mind, and it's very like kind of a lifelong thing I've noticed, at least in the clients that I see. So I do a lot of CBT, but it also kind of is also leaning towards more of a holistic approach as well. Same with ADHD, really focusing on how do their habits, behaviors shape the symptoms that they experience, and how can we kind of make those like habits work best for them in managing their symptoms. So yeah, that's kind of a glimpse of what I do. I would say I use a variety of different things, CBT, DBT, and ACT as well. So that's what I do.
That's great, because I see so many clients with ADHD that think medications are their only option.
Mm-hmm.
And actually, if they learn these different behavioral techniques, I always say, like, ADHD is a superpower. If you learn how to harness it, you can go so far. And again, it's just letting them take control of these diagnoses and take back that control, rather than feel like, oh, I have ADHD, I'm not going to do well at work, or I can't keep up with my colleagues. It's just not true. So that's great to hear.
Yeah.
Hi, I'm Katie. I am a dance movement therapist, as well as just a talk therapist as well. And so I specialize in anxiety, depression, and I like to work with people that have experienced trauma, whether it's childhood trauma or complex trauma, just kind of being able to dive in and process a lot of their trauma, because as you know, trauma gets stored in the body, and being able to move through some of that. And yes, taking a very holistic approach. I also, dabble in a little bit of eating disorder work too, just how that's all kind of tied into just kind of the whole self, and how that's really related to confidence and self-worth, and the body image piece of eating disorders is kind of my focus there. But yes, just kind of seeing all of those different parts and pieces. And yes, you're speaking my language of just how much emotions and the mind, the body, everything is so interwoven and interconnected. And just, being able to have your clients learn their own language of their body. It takes time and perseverance and the resilience that they have. But it's just really amazing to watch them grow, and to be able to kind of say, like, I can identify what it feels like to be angry, and it feels like this in my body. So it's definitely an experience, and very, like you said, spiritual too, just to kind of like have that connection. So yes, very excited to have you here with us today.
Thanks, Katie. I was going to ask, how do you do the dance or the movement therapy virtually? Do you incorporate that in?
Yeah, a little bit here and there. We're not, like up and, like dancing through the space, but, like just being able to notice the different tension flows in, like people's bodies, and being able to kind of say, like, is there a gesture or posture or some type of, like small movement that is related to that emotion? Or how do we, like kind of modulate through, okay, I am feeling very stressed out right now. My body's feeling tense in this space. How do we pull that through? And, like, how can we kind of start to, like I said, modulate from this posture over to this posture, so that we can allow for, just a little bit more like movement and grounding to happen, like through that space. So I used to work with more like authentic movement in, like group spaces in a residential facility. And so kind of being able to kind of like take that same idea of authentic movement, but just kind of like bring it more to like a safer space, because that can be very vulnerable. I learned through that experience, and people are kind of a little more hesitant to have that authentic movement experience, which is very helpful, but just not everybody's cup of tea. So just to, be able to utilize movement and gestures, or, like if I'm noticing, like, oh my gosh, like I'm noticing you kind of like having the same repetitive movement. What does that, like mean for you? So just using, the body language that my clients are trying to offer up as well.
That's awesome. I love that phrase, like, I'm noticing you. Because a lot of times that's something that they're doing every single day or like all day, every day, and they're not going to catch on to it. So that's great.
I can go next. I'm Rachel. I primarily work with clients who struggle with OCD, anxiety, and panic disorder, using a holistic approach as well. Also, to very like spiritual. I'm very spiritual myself, so if my clients are open to it, which most tend to be, I will incorporate that in our sessions. But also to CBT, I use a lot of ACT, and then also exposure therapy, obviously with my OCD clients. But yeah, I love where you were talking about just like meeting the client where they're at. I find that a lot, especially with like my OCD folks and my panic disorder clients as well. So I think that's always like really, really important. But yeah, love everything that you stand for and that you were talking about. I resonate with it a lot. And I'm just already thinking about like some clients who I'm like, I feel like they would benefit a lot from your practice. So yeah, thank you for being here.
Thank you.
Yeah.
I can go next. Oh, Sydney, do you want to go? No? Okay, just me. I'm Jenna. I'm the other Jenna, brunette Jenna, not the owner Jenna, whichever way you want to put it. I am a talk therapist and an art therapist, mostly visual art. But I do, resonate with like if people are interested in music, if people are interested in writing. I like to utilize that. Mostly whatever they have in their homes. If you've got it in your house, we can probably make art out of it. It's not something that I practice like the majority of the time, but I always let clients know and offer that as an option to explore emotionality, explore what's going on in their bodies. There's a lot of different techniques to use to connect, mindfulness with the body, and then also art, which I very much enjoy. I mostly utilize CBT, DBT, and ACT as well. Really heavily on the DBT these days, focusing on anxiety, depression. I am a couples therapist, and then I do individual couples counseling as well. So mostly focusing on communication and relationships and stuff like that. So yeah, love what you're doing. A big fan. So
I saw those.
yeah, definitely already thinking about ways to collaborate with you and things like that. I have my own spiritual practice as well, so definitely resonate with all the energy work. So cool stuff.
Awesome. So you do virtual couples therapy?
That I do. I do virtual couple therapy.
How does that go? Like, does it feel like people can connect through the camera? I guess I've just never done it, so that's
Yeah, I think so. I've done it both where like the couple is like on the same screen. That's how I prefer it, so I can watch how they interact with their bodies. But I've also done it where they're on different screens. And funnily enough, they can actually see when I'm looking at the two of them. So it works out pretty well, and I enjoy it. So
yeah, great.
I'm Sydney. I'm the newest on the team. I've been at Headfirst for a couple of months now, so still in the very infancy of my therapy career. But some areas of focus are clients experiencing eating disorders and some career exploration type areas of focus. I love using like an existential approach in which kind of just like finding out what gives clients life meaning and purpose, and like really diving into those kind of conversations. Mindset reframes is a huge part of my work. I definitely utilize that a lot. The gratitude journaling that you mentioned is something that I like heavily incorporate as well. Exploration of the past, particularly with like eating disorders and history of dieting and mindset surrounding that, is like a huge focus of the work for clients experiencing that. And then, yeah, definitely just like an overall holistic, it seems common theme here, but just everything that you mentioned, like sunlight in the morning and caffeine and sleep and all of that is like a huge area of focus for me for diving into. And yeah, definitely keeping in mind through the work as well.
Isn't it funny that like maybe at some point people didn't approach these things holistically and they didn't ask about sleep or nutrition. I think now just the way that our society is going, it's known that that's important. So I'm so glad to meet you guys who have that holistic training in mind and approaching your clients with that as well. Because I think even, I don't know, 5-6 years ago, like through my training, it wasn't talked about as often. So it's nice to collaborate with people who are doing that work too.
I think that like each decade, it seems like work-life balance is getting more skewed. So it probably needs to be even more of a focus now than ever because it's becoming even more of a extreme.
Right. And then that's where how you were saying like that existential approach of, okay, well, what really fulfills you? Like, yes, you have these goals to work a lot, have a lot of money, or get higher up in, your business or, in the corporate ladder, whatever that is, but is it really fulfilling you, let's say?
Mhm.
And so starting with their value systems and understanding how to truly make them happy or how they will make themselves happy. I think that's a great place to start.
Yeah.
Yeah. So I know we're about at time here. So I just want to be mindful, and I don't know if there's any like extra questions that you all have that you all can ask before we hop off, but I did just want to, say thank you again. And also, like you were just saying, how I know when I was in graduate school and started my internship, this was absolutely not the norm. There was no conversation about what you consume is going to affect how you feel. And that consumption stems from what you're watching on Netflix to what you're eating to how much you're sleeping. Like to community, spirituality, connection to others. And I think over time, community has been dwindling more and more, which we also can feel with our clients. Like we could feel as therapists, even like the weight of that, of us having to carry a lot of that connection and make those connections for folks because they don't have it. But these conversations, this model wasn't being done. And it is part of kind of the ethos of Head First Health of we look at all aspects of health and we want to recognize those. And we know as therapists, like we're really focused on the head health. So that is where we spend most of our time. But really this is how Conscious Collaboration Series was born, was with the intention that we would have this exact kind of conversation and being able to connect with providers like you. So I know when you and I met, I was just so excited and to see someone from the psychiatry world that also resonated with us. It was just like, oh, this was such a great match. So I'm so grateful that you took the time to be able to meet with us and share with the team everything you shared with me. And it seems like everyone here is also in agreement with just how wonderful you are and what you're doing and what you're providing for patients. So thank you again for this.
Oh, of course. Thank you for having me. And yeah, if you guys have any questions like after the call, feel free to reach out to me personally. Jenna, I don't know if you're going to pass on my information.
Yeah, if you want me to give them your email, I can give that as well. I've gave them, everyone has your website and all of that, but I'll also put your email in there.
Yeah, and feel free to reach out whenever for personal questions, career questions, whatever that is, or to collaborate on clients as well. I'm happy to work with you guys.
Great. All right. Any last question before we hop off, or are we all good? Cool. Well, thank you again. I will be, of course, I'll be in touch, and everyone else, I'll send you all her email for you all to be in touch too.
Nice to meet you guys.
Thank you so much.
Bye.